true.
Y le dije a Chuy, ya me voy a subir porque tú dijiste cuando pasáramos esto,
Esta parte.
ya podíamos. Y el 14 me deja mucho como ya de síntomas y qué
Yeah,
relación.
14 was a long chapter and
Sí,
it has a lot of assessment.
y estaba yo bien prendida, pero no lo alcanzaba a estudiar todo, ¿no? Como qué síntomas tiene y qué enfermedad puede ser.
Right.
Eso es la conexión que tengo que hacer. Si tiene esto, ¿qué puede ser? Porque esas son las preguntas que no entiendo ahorita. Como,
Sí.
si tiene esto y tal, ¿qué puede ser? ¿Qué enfermedades puede tener? ¿Son críticas o no tan críticas o así?
Ujú.
Eso es donde todavía no las conecto.
Right, right.
Y le dije, ya dijo Joshua que en uno de estos días ya me voy a poder subir solo. Necesito subirme
Ajá.
cuando tenga un día bien ocupado, como también tiene los wheelchairs que transportan. Necesito andar checando a los viejitos que a ver qué tienen, a ver qué les pasa.
Right, right. Okay, going on the legal issues, confidentiality. Confidentiality, again, remember that patient information and patient documentation is kept confidential. HIPAA, okay? The Health Insurance Portability and Accountability Act requires ambulance services that are covered by the law to take certain steps to safeguard patient confidentiality. Okay, it includes placing completed PCRs into a locked box. You know, when the reports cannot be left on the table like that at the station. They gotta be in an area, even if, as long as they're covered or turned over, you know, but they're in a certain area, then that's okay. Or leaving a report on the dashboard of the ambulance, so somebody can pass by while you're having lunch and they can pass by and see the information on the report, you know, that cannot be done, right? So even at the station, the reports have to be covered, you know, unless you're working on it, okay? So that's important. Patient refusal. Sometimes we go to patient calls where the patient does not want to go to the hospital. You know, it is our responsibility to explain to the patient the consequences. You know, we're not going to encourage them not to go or to push what they call pushing a refusal, meaning convincing him not to go. You know, a lot of medics out there will do that because they're lazy and they don't want to transport, right? But that affects the company overall. So we want to make sure that if a patient refuses, that we try our best to make sure that, or try to convince them to go to the hospital. And if they still refuse, then we want to explain to them the consequences of refusing care.
And getting the signed form.
And getting a signature, all right? It's important to get a signature. Everybody's saying there's a long test.
La primera bateada que mandó Josh, casi siempre No, yo estaba risa y risa y cuando llegué al de ese que voy volteando y que miro 50, 60, 70, no me lo dado para llevar.
Okay, so, you know, the patient will refuse from time to time, you know, what we call a refusal. We have to document why, okay? We have to document what we did to try to convince them to go. You know, patient was repeatedly advised to seek further medical attention. All consequences were explained to the patient. Patient verbalized understanding. Patient said, I understand. You want to document that. Family members were also explained of the consequences. You know, police officer witnessed, patient signed the refusal. You know, you never want your partner to sign. You either want to get a family member to sign or a police officer to sign. You know, because if you get your partner to sign, if something goes wrong, then they may say, well, you're trying to cover up, you know. But if you get a family member, they're not gonna accuse the family member or a police officer, you know, so you wanna get them. And what they're signing is that they're witnessing that the patient is refusing to be transported to a hospital. You know, I've had patients that are very ill and they're refusing, you know. So we cannot force them if they're alert, if they're oriented, we cannot force them. But if they're unconscious, then we transport them under implied consent, right? And we're able to take them because implied consent says that if they were conscious, they would want us to do what's best for them, right?
What do you do if they're the only person there? You don't have any witnesses?
And they're unconscious? Or they're conscious?
That they're refusing.
Are they alert?
Yeah.
Then they can refuse, but we want to document that we tried to transport them and convince them. And the signature, yeah. Sometimes they don't want to sign and that's okay. You want to document that the patient refused the signature, right? Most of the time they do, but, you know. Or sometimes the patient may say, well, I didn't call you, my daughter called you. You know, and I don't want to go to the hospital. Sometimes you may also involve the family members and explain to the family. I already explained to the patient that the patient's, you know, he's having chest pain, it could be heart attack, he can die. Sometimes the patient needs to hear that they can die if they don't go to the hospital. Right, and then family members, when you explain that to family members, then they may try to convince them also, okay? So, from time to time, it does happen where they do refuse, the transport and sometimes even the care, of a patient. I had a patient one time that he was having a, is that somebody for you?
Is this for a meeting?
No, I think it's next door.
Okay.
He was having chest pain, okay? And chest pain patients having a myocardial infarction, they sometimes will deny that they have pain or that there's anything wrong with them. So he was denying transport, and we clearly saw his vital signs were not normal. He had chest pain, he was diaphoretic, sweating, and you can tell he was in pain. The EKG showed us he was having a heart attack, and he didn't want to go. He didn't want to go, and we tried to convince him he didn't want to go. We tried to get the family members, and nada, he didn't want to go. So I told the family members after he signed the refusal, and I explained to the patient, okay, you're maybe having a heart attack and you can die from this. He says, that's fine, if I die here, you know? So I said, okay, well, sign here, this is a refusal, this is releasing us from any liability, this is saying that we explained to you the consequences and that you were able to understand what we told you. And he signed. We told the family members, and you know, if he passes out, call us back, you know, we'll come back. And I knew he was gonna pass out, so we went around the block and we waited. And sure enough, they called back. Within 10 minutes, they called back. We responded. Unfortunately, he was already in cardiac arrest, and we took him under implied consent, and he ended up passing away. You know, so, you know, we got to do everything that we can to convince him.
¿Y cómo le haces cuando el paciente está como drogado? Está alerta, pero no está alerta, ¿o sí? ¿Cómo es esa situación?
No, they're not alert. If a person is intoxicated and they're not able to make decisions, and they're not coherent, they're not mentally competent, then we take them under implied consent.
¿Y cómo le haces si te va golpeando o lo que sea? ¿Lo amarras? Como dijeron ahí, ¿te amarras para que no te golpee?
There has to be a reason to restrain. If he's violent and he's trying to assault you, then we're going to use soft restraints to restrain him. But again, you have to have it in the protocol. The protocol has to say, violent patients, this is how you're going to restrain
Y lo que
him.
haces es hablar a la policía luego si el paciente
You can call
está
law
sin el
enforcement to
protocolo.
witness that a patient is being violent.
Pero no te lo vas a llevar hasta que no esté la policía ahí.
True.
Okay.
Yeah, until they're there to witness. I mean, unless it's something, you know, critical, that they're really sick or injured, then we can still transport. But again, it goes down to the protocol. If you don't have a protocol to restrain, which I've seen protocols that they don't have it,
Some doctors don't get.
and they're restraining people, that could be a lawsuit, okay? So most of the protocols have them, but there's, from time to time, there's some that they don't have it, and then you're really like, I can't restrain this patient. Call law enforcement and have them come in, you know? So it's about based on protocol. And for some reason, I'm not getting the rest of it. Okay. What is the next topic there in that chapter after refusal?
Clasificación.
Classifications?
Special.
Clasification.
Okay, ahorita.
Oh,
Mira como traigo el libro ya. Con todos mis capítulos. Ahí voy para atrás y ahí vengo.
You know, these are the classifications of what?
Dice falsification.
Oh, okay. All right, so the falsification.
oh, falsifications.
What that's is gonna talk about is, you know, we write down what we find. We write down what the physical assessment, the vital signs and all that. If you cannot, let's say, for example, and the most common thing of that people falsify is numbers, the vital signs. If you take a blood pressure and you cannot hear it, you cannot put, oh, it's 130 or 70, okay? If you do, then you're falsifying a record, okay? So you wanna document, or you tell somebody else, it was, you know what, I can't hear it, can you check it? Maybe the other person may be able to
Como
hear
yo
it.
ese día que tenía la señora aquí con
Right.
ese apretado, no oía nada.
No, right? Okay, so again, that's what they mean about falsification, or falsification, something that didn't happen is important. What's the next topic there?
The next topic,
Refusal information sheet.
yeah, refusal information sheet.
Okay, that's just
The form that you have signed.
the Wi-Fi?
Yeah, you're not connected.
Well, it's not on Wi-Fi, it's on,
Oh, you're using the.
yeah,
Si
it's
quieres
on,
agarrar el libro que el pollo como quiera lo voy a checar al rato.
okay.
The other was the documentation of patient
Correcting,
refusal.
do we do, okay, correcting errors, okay? When we correct an error on a patient care report, we draw one line through it. If it's written, we draw one line through it and we initial it. We don't scratch it off and try to hide it,
out.
because then that's what it means, that you're trying to hide something, you know, so we'll just draw one line through it.
Sí, lo que escribiste y
Así.
luego resaltar que te equivocas.
Yeah, just
Es
like
como
it
los
is.
cheques, ¿no?
Mhm.
Cuando llenas un cheque y de repente metes otro, lo más.
Draw one line, right. Mhm. Okay. Specialty situation, multiple casualty incidents. You may go to calls where there's 10 patients. Okay, you need additional resources. Okay, you need to do the triage here on page 435. It's showing you during a multiple casualty incident, triage tags are used to document the information of the patient. And what a triage tag is basically you classify the patient as normal, delayed, which means needs to go to the hospital but not fast. Then you have the immediate, which this is a critical patient, you need to go now. And then you have the dead. Okay, when you have 10 patients, if I have one person that's in cardiac arrest with no pulse and respirations, they're dead. We're not even gonna work on them. Okay, I'm gonna work on the person that's having trouble breathing and chest pain, but not on the dead guy, because we don't have the resources. We'll all have to concentrate on that one patient, and we don't do that. Okay, so these triage tags that are in the ambulance, you go and you assess every patient, a quick assessment. You know, and I'll bring a little game that I have that you'll be doing triage within 5 seconds. So if you're looking at the information, this one goes here, this one goes here, real quick. I'll bring that next week. So you assess the patient, you classify the patient on color coded. That little section there is perforated, so if the patient is green, you leave the green on, right? It's a minor. If the patient is delayed, you take off the green part, and you leave the yellow, so that's delayed. If the patient is immediate, you take off the green and the yellow, or the patient is dead or deceased, you take off all the way up to the red, you take that off. So in that case, you won't waste time reevaluating patients. There's 10 patients, there's a whole bunch of EMTs and paramedics that are gonna come and see patients, but if I see a tag on the patient, okay, I don't need to go check that patient because that patient was already checked, okay? And these tags are used on multiple casualty incidents, okay? When you have anything more than 2 patients, it's considered an MCI, technically. 2 patients, you may be able to transport in one ambulance if they're both stable, you know. 3 patients, maybe not. Okay, the most I've taken on an ambulance, on a backboard, all of them, is 4. Okay, and
4 in an ambulance.
4 in an ambulance on a critical patient. It was border patrol chasing a car, the vehicle rolled over, bodies flew out. We started off with 4 patients and then ended up with 11 patients that started popping up because they were in the grass, tall grass and stuff. 4 patients, and the only reason I was able to take 4 patients in the ambulance is because it had a special hanging hardware system mounted on the ambulance that I was able to put one on the stretcher, one on the bench. Above it had a hooks that come down, 2 hooks and hooks on the wall. You put the board, hook them in there, and on the other side also, 4. So that means 4 patient assessments, 4 vital signs, 4 O2s, 4 assessment, everything. Okay, 4. So all patients were stable, but because of the mechanism of injury in that situation, a rollover, then they internally, I didn't know. So when I call ready report, okay, we're en route to your facility with 4 patients of a motor vehicle rollover. Patient number 1, patient number 2, and 3 and 4, you know. So, you know, it just depends on what the ambulance is able to equip, you know, usually 2 patients stable. Critical, 1.
Cuando está crítico más.
Yeah, 1, all right? So, special situation reports, for example, if you come across an exposure to infectious disease, you need to report it. Injury to yourself or another EMT, if you get assaulted, you need to report it. Hazardous or unsafe scenes, again, referrals to social services for elderly. If you go to a scene where there's a possible elder abuse or child abuse, you need to report it. We're not going to accuse anybody and point the finger of anybody, but you do need to report it, okay? And you report it to the police or to the hospital, and they'll get child protective
Y
services
cuando
or.
están golpeando también, entre la pareja, por decir, también.
Yes, you need to report it. Mandatory reporting for child and elder abuse, okay? Or any sexual assault and all that, it needs to be reported, okay? All right, so that concludes, chapter 15, right? Yeah, chapter 15.
Yeah, the rest is just
Okay.
forms.
All right, yeah.